guys, welcome back to Medical Coding with Blue. Today's episode is all about AI, computer-assisted coding, and the future of medical coding. If you are brand new to my channel, welcome. I am Blue, I'm a medical coder. Okay guys, first of all, this video is my opinion and my opinion alone, okay? That's number one. Number two, I have 15 years of experience in the health information industry. In this 15 years, I have held 3 certifications in medical coding. The first one was the CCA. That is a Certified Coding Associate. That says that I have the entry-level competence to understand inpatient coding and outpatient coding. That was superseded when I got my CCSP, the Certified Coding Specialist Physician Base. That is a mastery of the outpatient setting coding. And then I got my CCS, which is the mastery medical coding certification. This says that I have mastered inpatient coding and outpatient coding. In this time, I have seen a few changes in the industry. Of course, going from ICD-9 to ICD-10. I was part of that whole changeover. That happened in October of 2015. And there have been advancements, of course, with the encoder. That is the electronic code book. Basically, you put in a few words and it will take you through a decision tree and then it'll give you a code. It's an electronic way to get through looking up codes quicker, okay, versus going through the book. Although you should always keep up with the book, I will say that. The electronic health record has gone through a tremendous amount of change. The electronic health record is fairly new, and given that it was really starting to pick up steam in the early 2000s, right? And then, of course, with the implementation of HIPAA and high tech being in the early 2000s as well, there's been a lot of change. And there's always going to be this evolution of the technology that we can use. Of course, Encoder has helped us. The electronic health record has helped us. It's helped physicians, of course, with providing clinical decision support, okay? And giving other options that they may not have thought of, right? And so it has become a wonderful tool to help people to, find ways of becoming more healthier and just different treatment options if there's just sort of a situation where a provider is stuck, okay? What I will say is this: every single individual is different. Everybody is different. No two people are the same when it comes to, in terms of health and all of their health factors and everything else, and family history, any sort of conditions that they carry and things like that, any sort of conditions that develop. So with this said, every provider is different in the fact that they think differently. They were taught by different teachers. They have different levels of motivation when it comes to learning more, because physicians do have to constantly learn, just like medical coders do, okay? So the whole notion of, AI is going to take over and, there's going to be all this computer-assisted coding, that's already taking over. This is not true. Again, computer-assisted coding is going to be an additional tool, but it will not eliminate us. It will not eliminate us as medical coders. Again, my opinion, okay? The reason that I say this is because with computer-assisted coding, what it is it's looking for words, much like artificial intelligence, which takes a myriad of resources and sort of goes through an algorithm and figures out what is it that you're trying to ask, or answer what is it you're trying to ask. But with computer-assisted coding, it's highlighting different words because that's what it knows to do. It knows to highlight words, and it knows that, okay, maybe this is it. Maybe this is what they're asking for. We all have, if you've been in the industry long enough to know, you've seen computer-assisted coding. I've seen it. I've also seen it where I'm working with it, and it highlights the word fall, F-A-L-L, fall. But in the instance that I'm looking at this record, there is not an injury because the patient fell. The doctor was referring to the season, not an injury. So these are the little things. AI and computer-assisted coding do not understand nuance. That's where we come in. So if you are hearing, oh, AI is going to take over, computer assisted coding is going to take over, that is words from somebody who does not understand what we do. Somebody that does not understand anything about the health information industry. And anytime I've talked about this very subject before, I've always gotten the nastiest comments from males who are not in the health information industry at all. They're in the tech industry. And they come and tell me about my industry. Well, if you're so sure and you're so confident of your product, then why are you trying to discourage me from talking about what I know in my own industry? Why don't you stay in your own industry there, sir? I'm just saying. The other thing I have to say to you guys is this. If you're allowing somebody who does not know a thing about what we do in the health information industry, if you're allowing them to discourage you or dictate to you what you should and should not do for your future, I feel sorry for you, because that means that you're allowing other people who don't know about anything of what we do to rule and dictate what you do. It's your life, your career. They have been saying this to everybody that will listen, even back when I first started. And if I had to listen to them, I would have missed out on a wonderful career that's already spanned 15 years. I would not have my channel. I would be doing something completely different if I had listened to those people. So that's why I say you can't listen to everybody. You have to listen to the people who have been in the industry and who know. And maybe some veteran coders may tell you, oh, you should get out while you can because blah, 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 this or that, because they're miserable with what they do. But then, of course, there's other factors that may be affecting their response to you, such as burnout, or they're not being challenged enough, or maybe that they just don't want to do this because they got into it for the money. And like I said, if you're getting into it for the money, then you're getting into it for the wrong reason. I'm just saying, because if you chase money, you will always be miserable. But if you don't chase it and you enjoy the ride of learning medical coding, if you enjoy the process of learning it, trust me, that money will show up, because medical coders get paid very well. And we don't talk about money and specifics on my channel, but I will say it's a very comfortable life. If you are willing to invest in your own knowledge, because you do need knowledge. That's what this field is. And it involves critical thinking. Again, a key skill that AI will never have, that computer assisted coding will never have. We have it. And the reason that I say this is because I want people to understand it's not all cut and dry. When you think, oh yeah, the robots are going to be taking over and all this and all that. No, we still need to critically think. And if you're out there and you have that skill of critical thinking and reading comprehension and all those things that you need to be a successful medical coder, then you don't have anything to worry about. You continue to study and do what you need to do to pass your exam, to get out there, find your first job in medical coding, and then you go move forward, okay? Because we are going to be in ICD-10 for a little bit meaning a while, and then we're going to move up to ICD-11, but that's years down the road. And these things are constantly updating, constantly. So for AI and computer assisted coding to keep up, it always has to be updated, constantly updated. Whereas we as medical coders, as long as we maintain our knowledge, we never will have downtime. We will never have to be updated, because we will constantly be doing this, versus a program that has to be managed by a human in order to think all of these things. Okay, so again, it's not a reason to worry. And if people write in and tell me, well, Blue, what about the transcriptionists? Look what happened to them. Everybody kind of knew that was going to happen with transcriptionists. Everybody knew that. Only because the second they started being able to have microphones and like all of these computers and things like that, and have dictation, and providers were able to speak, and it was able to use natural language processing, these programs, and then be able to, write all these things out. We knew that was going to happen. We knew it. But medical coding is something completely different. Same thing like medical billing. It is completely different. This is not something that can be left to automation. It's not, because again, it requires people to critically think. Every single note is going to be written differently. And even if a provider uses a template, there's going to be times when maybe there's a typo. Maybe there's a thing that, maybe it was on the left and they documented on the right, but if you're looking at it, you can recognize that, oh, it should have been on the left and not on the right. And you're, able to send that query to clarify, what happened here. Whereas the computer is not going to be able to know that and to be able to say, oh yeah, this is missing or this is missing, or clarify which side it was, or, whatever. Because again, it's programmed to look for words. It's programmed to look for certain things. And I have seen the computer assisted coding completely miss a whole diagnosis. So again, it's not fail proof. These things are still very much in the teeter-totter phase, much like the encoder was. But the encoder didn't cause people to panic then either. But there were some people that were saying, oh, that's going to do away with coders and we're not going to need books. Lies. We will always need books. We will always need medical coders because of the simple fact that we have the brain, which is why I tell you all to continue to study. But there's people that think that once they get their certification, once they're done with school, Blue, I don't have to study anymore. I'm so glad. And, no more books and things like that. If that's your mentality, you are on the road to ruin, because that means you're not going to continually learn. You're not going to be able to keep pace with other people. And there's going to be a lot of advancements that you're not going to be able to catch. I always say all the time, we have to know what medical coders have to know what doctors know while never having gone to medical school. Doctors I've seen surgeons, right? I've gone to surgeons' office before, seen them with their huge books that are like that big, sitting there studying over this book before they go into surgery, or they know they have a big surgery coming up. So they're looking at the anatomy, they're looking at different approaches to the surgeries and things like that. They are constantly learning because they have to. It's the same thing like us as medical coders. We have to be able to read what they're saying, so we have to be able to comprehend what they're saying. And again, this is a skill that you build as a human being. I am not competing with AI. I'm not competing with computer assisted coding. Why? Because I know that I have the skill that is needed to be a really detailed medical coder. So that's why I'm not worried. But if you want to let other people who have not been in the industry scare you into not pursuing this, into not going forward with your studies and things like that, you were probably looking for an excuse to stop studying in the first place, because it is a lot. It is a lot. And some people get involved in it, think, oh my gosh, Blue, I didn't know it was going to be this much. It's a lot, but it is so rewarding. And the time and effort that you put into it is worth it. It's not that this is going to go away overnight. Now, 100 years from now, when we're all gone, it may be a different story. But that's 100 years from now. If you spend so much time thinking way far ahead, instead of being present, being in the immediate present, and maybe a few months down the road, you can still be planning. But don't try to think about too far down the road when you have no idea where you're going yet. Okay? Again, this is not a waste of time. This is a wonderful career field, filled with lots of opportunity, because it's not just coding. There's other things. There's health data analytics, which is another thing. Okay? Again, it needs a human to be able to think and critically look at this data, not just a dumb computer, a dumb program, because that's essentially what it is. It is dumb until you tell it what to do, right? So that's the thing you guys got to think about. And, don't listen to these people that they think that they know. And if somebody is telling you something about medical coding and about the career outlook and things like that, if they are not a medical coder, take what they say with a grain of salt. Some people may be thinking that they're doing the right thing, trying to discourage you from getting into it, but really they're not, because if you don't know, then what are you talking about? What are you trying to say to the people? Because if it's something that you personally cannot do and you're discouraging other people, that's you. That's not other people. That's certainly not other people. And if you always listen to somebody else who's not on your same path, then you're going to be living for other people, not for yourself. When I was applying to get here to my forever home, I wanted to come here because this was the closest that I could get to my hometown. And a lot of the other girls, once they found out, because I didn't say anything, but once the girls found out that I was applying for this job here, they told me I would never get it, that I was wasting my time, that I should never apply. Because in their mind, I didn't have enough experience. But you know, I still applied anyway. Why? Because what's the worst that they could tell me? No. Okay. I get that. I understand that, because at the time, I'd only had 8 months, 9 months experience at that time. And I get it, right? But guess what? I got it. I got it because I didn't listen. I got it because I believed in me. I believed in what I was doing, and I took that leap of faith. Because again, success takes faith in yourself. It takes faith in the unknown, and it takes you being willing to go through something and failing and getting up and trying again. And I knew that that was going to be my journey. I was going to fail. There's going to be times that you feel like you're going to fail, but it's never really a fail if you're learning from it, right? If there was things that I was learning, right, even in school, and I was just like, oh my gosh, you know, how can I get this? How can I get this? And then I got it again with my brain. I got it. So that's me building my own confidence. So have confidence in yourself and your opinion and your idea to pursue this. Don't let anybody else try to tell you, oh, AI is taking over. Oh, computer assisted is taking over. They've been saying that since before I started. And they also said that, oh yeah, all the coding jobs are going to be shipped overseas for cheaper labor. Let me give y'all something to think about with that cheaper labor. You get what you pay for, number one. Number two, if you don't understand English, if English is not your first language, this is going to be a struggle. Because again, this is advanced medical terminology and anatomy that's in these notes. We have to know what doctors know while never having gone to medical school. And somebody whose English is not their first language can look at a word. And I have personally seen this, where the person got computer assisted, right? They got cardiac lead and lead poisoning confused. Lead and lead is spelled the same way. L-E-A-D is spelled the same way. But because English was not their first language, they didn't catch that. It's the same thing with this computer assisted coding. It's the same thing with AI. All it's seeing is L-E-A-D. So again, it's not so, oh, it's going to take over like everybody thinks. So if that's what you're thinking, you know, you can choose to believe me, you can choose to not believe me. It's up to you. I mean, you're going to make your own opinion anyway. But I'm just telling you, as a veteran medical coder, we are going to be here. We are going to be here. But 100 years from now, when things are way different and we're all gone anyway, I don't know how it will be. But you know, for the time being, yes, we are here to stay. So don't worry about that. You continue to pursue your plan and your thoughts. Quit asking people their opinion that are not medical coders. Quit accepting other people's opinion, again, that are not medical coders, that are not from our industry or know what we do. You know, and if you are from tech, and you have your own opinion, that's on you. That's on you, bro. You have your own opinion. But this is my industry, and I know what it is. And I know exactly what it takes, and I understand it. And it takes a lot to understand, okay? Completely different things, I'm just saying. So, with that said, I'm going to go ahead and wrap this one up. Thanks again for joining me. If this video helped you, please like, subscribe, and share. And I will see y'all next time. Bye.